It is Indiana in the Morning and the voice of Indiana County, WCCS 101.1 FM and AM 1160. She is Dr. Karen Barr from the Indiana County Humane Society on the line with us. Our conversation brought to you by Marcus & Mack, a law firm representing injured people. Karen, good morning.
Good morning, Todd. How are you?
Wonderful, and it's good to have you with us here today. I'm very appreciative of your carving out some time. I know you've got a very busy schedule just like everybody else right now. But
Thank you for having me.
You have, of course, something that is very close to your heart. That's the Humane Society and all those animals that are being cared for there. And the challenges go on, and yet Indiana County people step up, and we've seen that time and time again. I know that's a big part of what you're seeing at the Humane Society too, isn't it?
Absolutely. Absolutely. We've been so appreciative of all of the donations and the community stepping up to help us, particularly in this difficult time of COVID.
Yeah. For those who don't know, take us inside the Humane Society and what the pandemic has done to your ability to care for animals and to really raise the funds that are necessary to do so.
Well, with COVID, we want to make sure that we're keeping our staff safe and everyone safe who comes through the building. So right now, unfortunately, we've had to put a stop to in-house new volunteerism. And, we really rely on volunteers, but we have to be careful about controlling the traffic through the shelter. Mm-hmm. All of our adoptions now start online, and then people need to make appointments to come in and see the animals. So they can't just come in and look around. And sometimes that hurts our adoptions, too. People have to look at petfinder.com to see all of the animals.
Yeah.
So, yeah.
So those are big challenges. So take me through that adoption process. How does somebody go about it now?
Well, all of our pets are on petfinder.com. They just look under the zip code, and they'll be able to see all of our adoptable pets. And then we have an adoption application. Everyone needs to fill out an application, which can be found on our website, www.incohumanesociety.com. That can be emailed back to us, brought back into the shelter. We also have paper adoption applications outside on our porch when we're open. Then we review those applications. Once the adopter is approved, then we call them and we make an appointment for a meet and greet with the animals.
Mm-hmm. Mm-hmm. So tell me, when you go to petfinder.com right now and you put in 15701 and you see the Humane Society animals, what are you going to see there? How many? I hate to put it this way, but what's on sale at the Humane Society?
Well, most of our animals are cats. We seem to have a lot of cats in the community, and so I don't know the exact number right now. I'm sure we have between 90 and 100 cats in the shelter, and I would say at least 80 on PetFinder. We also have, of course, dogs. Typically, we have anywhere between 15 and 20 dogs on PetFinder, and right now we have bunnies. We don't always have bunnies, but right now we have 7 bunnies, and they came from a humane situation, but they are now all spayed, healthy, seen by our vet, and ready for adoption for a $25 fee.
Mm-hmm. Beautiful, beautiful. And I know that right now there's something special for somebody. If they adopt a cat or a dog, they can get a second one.
That's true. We're doing adopt one cat or dog and get the other one half price. So, the prices on the animals really vary. Depends on how long they've been in the shelter. Depends on whether or not they're considered a senior animal. And, we always have discounts as well for veterans, for seniors. So there are lots of ways to get a little bit of a price break on an animal. But, all of our animals are spayed and neutered. They're all up to date on their vaccinations, which is really important. And so although they will need a vet visit, we have tried to take care of as much as we can for the animals and the adopters for when the animals leave the shelter.
When animals do come to the shelter, they can be in any number of different conditions, some very dire and some are healthy and adjusted and socialized. Tell me about Kuma.
Kuma is a great dog. Kuma came in as a stray. We believe, our strays come in. We don't always know what breed they are, but we believe he's a Shepherd Akita mix. And this poor guy has been at the shelter for probably a year and a half and came in terrible shape. Then He had a skin condition, so his fur was, he didn't have a lot of fur, put it that way. So, and he didn't really know how to be a dog. So the team at the shelter's been working with him over the course of time, and he's finally learned how to be a dog. He didn't know how to play before. He didn't walk well on a leash, and now he uses something called a halty, and he can still be a little stubborn at times, but he walks well on a leash, and he's just waiting. He's the most handsome dog. He's brindle, and he's got one ear that flops to the side and another one that sticks straight up. People should look at him on Pet Finder. He's very handsome and he's very distinctive.
Oh, yeah. Wonderful. I know that last week we had a police story about the seizure of some animals that were found in a home, and one of the notes on that police report was that those animals ended up at the Humane Society of Indiana County. How are they doing?
I'm happy to report that they're doing very well. There were 7 dogs and 1 bird. The dogs have all seen our veterinarian and are getting the proper care that they need, and they're getting all the TLC from the staff. So happy to report that they're doing very well.
Wonderful, wonderful. Now, those animals aren't up for adoption just yet.
No, there's a whole process that goes along with animals that come in from the police or who are seized by our humane officer. So right now, no, they are not available for adoption, and as soon as they are, we'll let people know. So.
Yeah. When we get to this time of the end of the year, and again, we're talking to Dr. Karen Barr, Indiana County Humane Society. I know that there are so many people who have stepped up and have helped during this pandemic, but throughout the course of any given year, there are people who just have a heart for animals, and they help the Humane Society. So I'm sure that you have some thanks that you'd like to pass along to folks who have helped you.
Absolutely. We are so grateful for all of the community support from people who bring us dog food and towels and supplies and donate consistently, monthly, and end-of-the-year donations. We would not exist without the community and the donations that we receive, and we are so grateful. And we've also been fortunate to partner with Delaney Subaru, and they've been terrific. We had a fundraiser with them in October, raised $3,100, and right now we're involved in the Share the Love, Subaru Share the Love. And so for each vehicle that's bought or leased in December, we're going to get a portion of those proceeds. And again, we couldn't be happier and more grateful for our partnership with Delaney Subaru.
Wonderful. Now, if I can ask you to take off your animal hat and put on your doctor's smock for a moment, Dr. Barr is she is a medical doctor, and I know that throughout the course of the pandemic, you have been there along with others, right there in the front lines, battling against COVID-19 and the coronavirus. So talk, if you would, for a second, and if you will, about the vaccine and about how important it is for us to hold on and keep fighting this because it's going to be a while before everybody gets vaccinated. And I know that you really want to get that message out to folks.
Oh, I certainly do. It's so hard to describe what it's like in the hospital, particularly in the ICU where I work, and how it's changing. It's changing so quickly. We're seeing more and more, COVID patients. We're seeing sick patients. We're, looking at how many ventilators we have and whether or not we're going to have enough if somebody gets sick. And so it's really hard to describe. But, the vaccine is so important. I was really fortunate to get my vaccine last week on Tuesday. And I had a low-grade fever for a day, but it was not any different than, I would say, the flu vaccine. And, of course, this is my first dose, so I have to get another dose. But, we really need to pull together as a country, as a community, and keep each other safe. And I think everybody needs to get vaccinated as soon as they possibly can.
No,
the frontline workers really, really need everyone's help.
I know that you're here in Indiana. The hospital at which you work is in West Virginia. Is it vastly different in West Virginia than what you find in Pennsylvania? It's
hard to say. Since I'm not in the hospital here, I do know that when I try to transfer patients to Western Pennsylvania, because I'm just down in Morgantown, I have a really hard time doing it because they're suffering what I believe is the same strains as every other hospital. Everybody's looking for a bed, looking for an ICU bed. So I think it's far far broader than my hospital, and I'm sure extends to Western Pennsylvania. I'm not really sure about Indiana. I know that they're working hard to manage their beds and their situation at IRMC. So everybody's trying to be prepared, but the more patients we have, the harder it is.
You got to do the job. You really have to stand up and make sure you're doing everything safely from your standpoint, and you rely on others to do what they can to stop the spread of COVID-19. And Dr. Karen Barr, we want to thank you for standing in that battle zone. We appreciate so very, very much all of our healthcare professionals, and you're one of them. But thank you, and we want to wish the best to you as we get through this holiday season and on into a brand new year.
Thank you, Todd. It's my honor.
Have a wonderful holiday. We'll see you.
Thank you.
There is Dr. Karen Barr with us this morning here on Indiana in the Morning, the voice of Indiana County. Voice of Indiana County.